The public narrative surrounding the pandemic response presented a pristine, unanimous scientific consensus. Behind the doors of federal agencies and medical boards, a different mechanical reality was operating to enforce that consensus. Highly credentialed physicians who scrutinized the safety data found themselves systematically targeted. Their clinical observations were met with administrative force, resulting in the suspension of their medical licenses and the destruction of their careers. Prominent practitioners like Dr. Paul Thomas and Dr. Pierre Kory had their certifications revoked and licenses suspended after decades of practice in good standing. This raises a specific logistical question. How did federal agencies mandate a novel biological product across the entire population while simultaneously neutralizing the medical professionals who flagged clinical safety signals? We are conducting a forensic institutional autopsy of the mandate era. By tracking the internal actions of health agencies, we can map how clinical autonomy was replaced by administrative force. The evidentiary foundation for this investigation relies exclusively on internal federal emails, official FDA resignation transcripts, and peer-reviewed biological data. The mandated COVID-19 response relied on a carefully manufactured architecture of administrative force rather than scientific independence. The Federation of State Medical Boards, or FSMB, operates as the primary punitive enforcement arm for the medical establishment in the United States. In July 2021, the FSMB issued a directive threatening the medical licenses of any physicians found spreading vaguely defined misinformation regarding COVID-19. The American Board of Internal Medicine executed this directive. They revoked the board certifications of Dr. Pierre Kory and Dr. Paul Merrick for utilizing alternative antiviral protocols to treat their patients. In the Pacific Northwest, the Oregon Medical Board targeted Dr. Paul Thomas, executing an emergency suspension of his medical license. The board categorized his standard practice of informing parents about the potential drawbacks and risks of childhood vaccination as gross negligence. Similarly, Dr. Renata Moon, a pediatrician in Washington, relinquished her license under extreme duress after her employer and the State Medical Commission threatened disciplinary action over her public comments. The core offense connecting these doctors was their decision to question the risk-benefit ratio of the COVID-19 vaccines for specific low-risk populations, particularly children. These board actions effectively abolished the practice of individual patient evaluation. Doctors were forced to comply with a rigid, centralized political standard of care, regardless of the patient sitting in their exam room. State medical boards ceased functioning as objective evaluators of clinical validity. They operated as a political immune system, aggressively eliminating medical dissent before patients could hear it. Enforcing a nationwide vaccine mandate requires a specific legal prerequisite. An emergency use authorization, or EUA, which temporarily allows unapproved medical products during a crisis, is insufficient. A mandate requires a fully licensed product through a biologics license application, or BLA. In the fall of 2021, Dr. Marian Gruber and Dr. Philip Kraus, the top two vaccine review experts at the FDA, abruptly resigned from the agency. Acting FDA Director Janet Woodcock and Dr. Peter Marks deliberately stripped Dr. Gruber of her authority over the review process to hyper-accelerate the approval of the Pfizer BLA. This timeline was compressed to a target date of September 15, 2021. This decision shaved crucial months of safety review off the standard evaluation process. Dr. Marks then demanded the timeline be pushed up even earlier. This timeline was reverse-engineered to align with the Department of Defense's impending vaccine mandate deadline. Both Dr. Gruber and Dr. Kraus later confirmed in explicit congressional testimony that they were pressured to approve the vaccine, specifically to provide the legal scaffolding for these mandates. The resignation stemmed directly from this conflict. Scientific safety review was entirely subordinated to political utility. The FDA engineered the legal foundation for forced vaccinations by intentionally discarding their own internal safety guardrails and silencing their most qualified experts. While the FDA manipulated public timelines, a hidden shadow network at the National Institutes of Health actively evaded legal transparency.
The Freedom of Information Act, or FOIA, is a federal law that gives the public the right to request access to records from any federal agency. Dr. David Morins served as the senior advisor to Dr. Anthony Fauci at the National Institutes of Allergy and Infectious Diseases. Internal communications reveal Morin's deliberately used a private Gmail account to conduct official federal business in order to circumvent FOIA requests. Morin's explicitly instructed his colleagues to avoid leaving an email trail. He directed them to send materials to alternative accounts so that their conversations would remain hidden from the public record. He admitted to deleting federal records entirely, a direct violation of 18 U.S.C. 2071, and utilized an end-to-end encrypted Proton Mail account to conceal his activities. Morin's documented his coordination with the head of the NIH FOIA office. He noted in an email that he learned his tactics from the official running the department, describing her as someone who hates FOIAs, ensuring official communications disappeared. The primary motive behind this evasion was protecting Dr. Peter Daszak and maintaining the flow of NIH taxpayer grants to the EcoHealth Alliance during the Origin investigations. Morin's explicitly associated himself with Dr. Fauci and identified as an NIH scientist, while simultaneously stating he must use a private email to prevent his communications from being accessed by the public. While demanding absolute medical compliance from the public, high-level advisors like Morin's actively bypassed federal record laws to shield their internal coordination from legal scrutiny. These institutional cover-ups and medical board purges were deployed to hide a distinct biological reality that was emerging in clinical settings across the country. The initial public health guidance insisted that the mRNA vaccine remains safely localized at the injection site in the deltoid muscle. Pharmacokinetic data later revealed the true behavior of lipid nanoparticles, or LNPs. LNPs are microscopic fat bubbles designed to encapsulate and deliver genetic material into cells. They systemically distribute their mRNA cargo throughout the entire body, accumulating in organs like the spleen, the liver, and the ovaries. This widespread distribution means LNPs are capable of crossing both the blood-brain barrier and the placental barrier. Once delivered, the LNP payload hijacks the host cells, forcing them to produce the SARS-CoV-2 spike protein. This process introduced spikeopathy, the clinical realization that the spike protein is not biologically inert, but acts as a highly bioactive toxin within the human body. The spike protein binds to ACE2 receptors throughout the body. ACE2 is an enzyme critical for maintaining blood pressure and vascular health, and the spike protein actively downregulates this essential vascular protection. Simultaneously, the spike protein interacts with TLR4 receptors on immune cells, triggering severe hyperinflammatory immune responses. These biochemical mechanisms directly connect to the severe adverse reactions observed in the public, such as vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT. VIPIT is a condition where the immune system attacks blood platelets, causing life-threatening internal clotting. The breaching of the blood-brain barrier by LNPs also connects to the observed neurological manifestations, including Guillain-Barré syndrome, a condition where the immune system damages the nerves. This systemic toxicity is the exact clinical data that dissenting doctors were observing in their patients, and the exact data they were punished for reporting. The mandated intervention introduced a systemic biological toxin. The medical establishment functioned as an institutional shield, attacking any doctor who successfully diagnosed it. The COVID-19 mandate machine relied on 4 structural pillars: FOIA evasion, FDA timeline acceleration, FSMB medical purges, and the suppression of lipid nanoparticle toxicity. Illegal FOIA evasion was executed by top health officials to hide deep conflicts of interest and obscure the origins of the crisis. FDA leadership explicitly bypassed their own safety experts to manufacture the legal basis required to implement nationwide mandates. State medical boards were weaponized to crush physicians who detected the resulting toxicological crisis in real time. The mandate era demonstrates that when compliance is prioritized over clinical safety, the institutions meant to protect public health facilitate the suppression of the data they were designed to monitor.